And now, Rob on the Road, exploring Northern California.
Welcome to Rob at Home. I'm Rob Stewart, and it is great to be with you. I'm so glad you are here. Our guest for the entire program is someone I've wanted to have on for quite some time. David Heitstuman is the CEO of the Sacramento LGBT Community Center, and David joins us right now on Rob at Home. David, great to see you.
It is so nice to see your face, Rob. I miss you, and thank you very much for having me today.
I have missed you too, and it's so nice to virtually connect until we can safely in person. David, thank you for this. I want to start right out of the gate. 2020 has been quite a year, and that is the case, without a doubt, for everybody and the LGBTQ plus community. How have you seen just 2020, period, impact the community through the center?
You know, 2020 certainly is a year of unexpected challenges in so many different ways. Life for LGBTQ people is hard enough day to day, but layer onto that, you know, a pandemic, continued racial injustices in the world, the economic crisis, and just all of these things that layer on to the experience of LGBTQ people, particularly trans folks and people of color who were already challenged with unemployment and economic insecurity and healthcare challenges and access to care. And so people living with HIV, for example, have a higher risk with COVID. And so it's really been a year in which we've had to completely rethink how we deliver services and really step up the things that we provide to community members in ways and for people who never before thought they would be the ones in need of help. This year, with all of the other things, has just really coalesced in a way that is so heavy and exhausting just to kind of get up and walk around in the world every day. And so for myself, as someone who has a lot of privilege, I am making it, but it's hard even for me. So for those folks who are in a different position or do not have as much privilege, it's sort of unimaginably difficult. And I really have to say that the election result is super helpful in terms of a momentary sigh of relief. But there will be an enormous amount of energy poured into undoing all of the things that have transpired over the last couple of years, and be able to move our country forward.
How do you start the healing?
I mean, to start the healing, I think that you really have to take a step back and realize that there are 70 million people who thought differently, perhaps, than I did or you did, or and it's been hard for a lot of folks, I think, especially within families or colleagues and stuff, to sort of reconcile that I don't think that you're a bad person, but you clearly voted against what feels like you voted against me. And sometimes you voted against what we believe your own interest. And so we have to have a lot of difficult conversations, I think, within our families, within our workplaces, and within our communities. A significant percentage of LGBTQ people voted on the other side. People in the Latinx community voted on the other side. Black men voted on the other side, right? So there are we have to find ways to have these difficult conversations and increase understanding and have some empathy for one another and sort of restore some level of what's core to the values of this country and our values as human beings.
How do you begin that conversation? I mean, and let's just take it between us if we can't apply it to other people. How do we begin that conversation to bring back that we all have more in common than we are not alike? I mean, how do we do that?
I mean, I'll be honest, Rob. I don't have the answer. I don't know for sure.
I don't either.
We've been trying to. I think one thing that we shouldn't do is to just demonize the other side and say that they're bad people or that this is
And that's no matter what side you're on. We don't want either side to demonize either side.
Yeah, I mean,
it starts with recognizing each other, and it starts simply with love.
Yeah, and I think we have to ask each other, like, why do you believe this, the way that you believe? And why did you make this decision the way that you did? And have a conversation about how we can work together on the things that we have in common interest, and have some civility in this process. I mean, it is not going to be easy, and I don't know how we get there, honestly, because all of the social media sort of vacuums and bubbles that people are living in, where they only see things that reinforce their point of view.
That's a big deal.
That are portrayed as fact, that are not fact, and institutions like the broader news media that used to be that sort of standard bearer for what was true and not true. Now we have sort of a self-fulfilling prophecy of this media outlet is liberal and this media outlet is conservative, and this war kind of going on between them, and it's no longer sort of a war of ideas about as much as it is a war over what the truth is, and that's a really difficult place to be, I think, because if you can't agree on what is a fact,
that's a big deal.
It's a big deal.
You worked so hard to build this center up.
Yeah, this is my 9th year with the organization. And since the beginning, I wanted nothing more than for the organization to be able to be sort of self-sustaining, and for it to have a permanent facility where the community owns and has some ownership over that can't be taken away regardless of what's happening in the political or economic sphere. And for the community to have access to services that affirm their identities, whether that be in healthcare or in community building or in our advocacy work, that they really should have access in every aspect of their life to a place where they feel safe and affirmed in their identity. And when you go to the doctor, they should be respectful of your name and pronouns and your identity. Not just when you're in the exam room, but also when you check in at the front desk. And when you go to work, you shouldn't have to hide who you are in order to feel safe and to know that you are going to have an equal shot at a promotion. Or at school in the same way. And unfortunately, even in California, where we have a lot of legal protections, the experience for folks who are living in this community, especially for queer and trans people of color, is still a hugely disproportionate, less so than it is for someone like myself.
Mm-hmm. Talk to me, Dave. You mentioned about how it's important for people to know how to interact with people, face to face. And I would just love if you would share with our viewers right now the correct way, specifically talking about pronouns.
Sure. So one of the things that I typically like to do when I introduce myself is to say, hi, I'm David Heitstuman, and I use he, him, his pronouns. And it's an invitation for the next person who's being introduced or that you're speaking with to then share what their name and pronouns are. And without it being something where they have to make it a special case, right? So even here on Zoom, I put my name and I put my pronouns in the title of the video, so that it's clear for folks that I want them to refer to me. And that alone makes a huge difference to refer to someone by the pronouns, by their pronouns and by the name that they have chosen. Makes a huge difference, in particular for LGBTQ youth, for trans youth, gender non-binary youth. If there's one person in someone's life that respects their name and pronouns, that has a significant increase in their mental health and mental wellness, and reduces the risk of suicide by at least half.
Wow, that's huge.
It is. Yeah.
Wow, David. So let me ask you something. What if someone does not know what pronoun to call someone? What do you do?
I think, well, like I said, you can start by introducing yourself and your pronouns. So I even have it in my email signature. I make a habit of it when I'm in a meeting with a group of people. But if you don't know, and there isn't really an introduction, you can ask them, like, so what is your name? What is your name? And what pronouns do you go by? And that's fine. I think people are very open to that. Some people might look at you like they don't understand what that is. And there's an opportunity then for you to also educate and say, like, well, my name is this, and these are my pronouns. And I just want to make sure that I refer to you as you want to be called and be respectful.
You know, that's interesting, because that takes the fear out of it for someone stepping out to do it if they're unsure, because it's either an opportunity to connect or an opportunity to educate.
Mm-hmm. It also makes it, it lets the other person know that it's safe to be who they are in front of you, right? And that even if you make a mistake later, like you get their pronoun wrong, if you just apologize and move on and try not to get it wrong again. But that open from the start, like, I am interested in acknowledging who you are, and I want to see you for who you are, and use the name and pronoun that you want to go by.
You mentioned the dramatic decrease and the chance of suicide just by calling someone and recognizing, more importantly, someone by their correct pronoun, by who they are. It really boils down to someone saying to your other person, I see you. I see who you are as a human being. Mm-hmm. Suicide has been something that has unfortunately woven all throughout the LGBTQ plus community. Mm-hmm. And it is heartbreaking. It's heartbreaking in any community. You've seen that firsthand. You know people who have taken their lives.
Sadly, far more people than I would have ever thought that I would ever know. And the reality is, as I sort of spoke over earlier, is that even though we have legal protections, even though there's a lot more representation in popular culture, the experience of people in the world is not always so affirming. And so people at their church or at their school or at their doctor's office, if they are not being respected on a regular basis, or they know for sure that they would not be accepted, that fear and anxiety, just sort of walking around in the world every day, it takes a really big toll on folks' mental health. And so if you have other things going on in your life and that is layered on top of it, in addition to racism and sexism and all of the different isms, then your capacity to feel safe in expressing your gender identity or your sexual orientation in a space where you're just trying to get an education or you're just trying to like make income for your family, that becomes kind of like a lower priority. And so finding a way for community members to feel safer in self-identifying themselves and being open about that does make a difference in their mental health and reduces the risk of suicide that unfortunately is very, very pervasive in our communities today.
So imagine what it's like when a teenager is told it, or someone who has no tools to deal with someone saying, I fundamentally reject you based on something that they really don't know anything about. Mm-hmm. And I encourage you that if you have someone coming to you and sharing with you who they are and trusting you in that sacred space, to respect it, to love it, love on the person, and to show them through your love, not your words, what you believe. And I just felt like I needed to say that.
Thank you, because I think you hit the nail right on the head, and that if nothing else, just love. I mean, if you believe that fundamentally, like you're a person of faith and you fundamentally believe that God loves everyone the same, then you too should believe that you should love everyone the same. And I know we have a lot of parents that come to us and they find out that their child is LGBTQ identified, and a lot of times they do love their child and they want to do right by their child, but they're still afraid. They don't know what to do or what to say, and they don't want to step on a landmine and do something that will hurt their child. And so I think that the most important thing is just to love one another and love your child. Tell them that you love them, that it doesn't matter to you, that you love them no matter what, and then treat them that way too, right? Like it's difficult. It's difficult to say like love everyone on one hand, but then except for you, not you. Or it's I do love you, I love you unconditionally, but it's not okay for you to get married. Or I don't think that you should be able to do this or that. And so those are a lot of like difficult conversations sometimes you have to have in families and communities, but they're absolutely necessary and critical. And the more that we can talk with one another as people and acknowledge that we can love one another as people, as human beings on this earth who all have a lot of the same challenges, we can make a difference. And you noted the sign that's on the back wall of my office. This is not a problem. And as an LGBTQ person, there are so many instances where this big thing is thrown at you or that big thing is thrown at you, and you have no choice but to try to find a way in order to make things happen, just to survive, right? Like if you're a Black person in this country, your whole upbringing really has been driven probably towards survival and finding a way to survive, let alone all of the things that you want to enrich, have a good enriching life and a loving and happy life, just to survive. And so a lot of LGBTQ people, and here at the center, like no matter what happens, we're going to be here for the community. So no matter what challenge, whether it's COVID or unemployment or crazy policy things coming out of Washington, D.C. that harm our community, I have to look at the world in a way that's like, it's not a problem. We'll figure it out. We're going to get this done, and we're going to be there for our community no matter what. And that's sort of the attitude that I have to take in looking at things. We'll be there for our staff, and we'll be there for our community. We'll be there for that young person who is told by their family or their church or their community that they aren't accepted there. They can't stay here anymore. And we'll be here to open up our arms and welcome them home.
So you have people still today who reach out to you who have been rejected with no place to go.
Oh, absolutely. There's no question that a huge percentage of LGBT or of homeless youth that identify as LGBTQ. So we have across all of our housing programs 38 beds in our shelter, our transitional living home, and our host home program. And since the day we opened these programs, we've had a waiting list longer than all the beds we have filled.
And are those beds for LGBTQ plus homeless teens?
We don't discriminate against anyone at the center. We're open to everyone, but they are designed for LGBTQ youth from the ages of 18 to 24. And for our transitional living home and for our shelter, most of those youth, in fact, not all of those youth, have also been victims of crime. And so whether they suffered abuse at home or living on the street, or were in an assault, or were in some sort of violent situation, those beds are open for them. And so almost all of those beds are for LGBTQ identified individuals. We would accept, and we do accept, people who are not LGBTQ identified into those programs if they're the highest need and they're on the list. But yeah.
And they say the teens that you're talking about, and not just teens, but young adults up to 24, you said, have said that they are homeless because of who they are.
Mm-hmm. In most cases, the number one reason that youth experiencing homelessness who identify as LGBTQ become homeless is because they were rejected by their family and their community. They have nowhere else to go. So even though it's illegal to discriminate and harass and to treat people this way in California, it still happens. And the vast majority of these young people come to us and would not have survived living on the street, would not have survived without the support of a community who loves them. And that's what we try to give them. Is not only a community who loves them and a bed for them to sleep in, but a way for them to create a self-sustaining life in which they can fulfill the promise of their own destiny.
David, do you know somebody, I mean, specifically a person, and I'm afraid you're going to say it's many more than one, who was on that brink of ending it all, but made it, and not just survived, but thrived, which you will do. You will thrive because of the center or because of a conversation you've had. Can you tell me a story where someone's life has been saved?
I mean, twice in my life, I have been on the phone with someone who is telling me that they're going to end it, and that they have taken a bottle of pills and they have been drunk a significant amount of alcohol, and that they don't want to go on. And I've been on the phone with them and called them again and again and again and again until I figured out exactly where they were and what was going on, and was able to get emergency personnel to go to their place one time when I was hundreds and hundreds of miles away, where there was no way that I could possibly myself get there on time. And calling everyone I know to try to figure out where this person was exactly at that moment in time, and keep them on the phone and keep them awake and call folks in to come and help provide support. And one of these individuals in particular, they did come out of it, and they are very successful now. They are living in another part of the state and have a great job and a great support system. But there are these people who every day are struggling. They're struggling with life just generally, and they get taken to the brink. As a human being, like, life is hard enough for all of us. Why do people go out of their way to make it harder for other people? Well, there's nothing that I'm going to gain as a person, and even if there was, like, what interest is there, and that I have a hard time understanding in making life harder for other people. And
I would gently encourage someone who may feel that way, that they feel that their rights do not deserve to be shared with others, that is when it's best to look inward and find out what's going on inside versus casting your feelings on others. David, why do you, David, do what you do? I mean, you have had a big career already at a young age, at the California State Capitol, as well as at the center. And I'm curious, what drives you? Why do you do what you do?
In my almost 20-year career, I guess, the first 15 years of which I worked at the Capitol in the governor's office and for the Speaker of the Assembly and on some presidential campaigns, and really worked hard at what I thought was making a difference in the world and helping people sort of at the macro level, where we're influencing policy and the direction of our state and our country. And that was great. And it was really rewarding in some ways. But it was really distant from the actual experience of people living in the world, right? You pass a law, it gets signed by the governor, or gets signed at the White House, or whatever, the candidate that you want wins an election. But the trickle down of, like, when that actually takes effect, like, I never know the person who is impacted by that policy decision necessarily, not for several years before that gets implemented. And so it was great. It was a great opportunity, but there's also a lot more. I was always working for someone else, and I had to sort of work within the framework of what was politically feasible or possible and plausible in these scenarios. And I wasn't the decision maker. And the thing that, despite the sacrifices that are necessary to work in a nonprofit, let's be real, like, nonprofit agencies don't pay a lot of money and they're hard work. Never worked more hours in my life. But the thing I love most about it is that we both have the opportunity to help the person today that comes to us in desperate need of help. Like, when a homeless youth shows up on our front doorstep, I can get them a place to sleep tonight. And that is very gratifying. And at the same time, we can also work to change the systems that have force them here in the first place, right? We can work to change those policies that discriminate against folks and that are based in a systemic racism, and we can find ways to increase access to services for mental health, for example, for LGBTQ folks, and improve the safety and wellness of people who are going to school and going to work and going to their doctor's office every day.
What would you say, David, directly to somebody right now who is really struggling with who they are as a person, with their sexuality, with their gender identity, with just the fundamentals of who someone is? What would you pour into that person who is just lost in all of the thoughts that we know happen?
Almost every LGBT person I know at some point felt like they were the only one that had these feelings. And they didn't know that there are millions of others that feel and have the same experiences they are having. So first, I would just say, you are not alone. And second, that have hope. We are here. There is a community of people that loves you and embraces you. And if you don't have the strength to reach out, put yourself out on the street and we will find you. I mean, I don't mean put yourself out on the street like become homeless, but just stand out there and be who you are, and someone will notice, and we will come and embrace you and love you and be there to support you.
David, thank you so much for spending so much time with me today here on Rob at Home. It is always great to see you. I look forward to seeing you soon in person as the pandemic hopefully calms down.
Thank you, Rob.